just have a small short game called Fact or Fiction.
Okay.
Yeah, and the rule of the game is you explain very quickly. I'll say a statement and you answer fact or fiction.
Okay.
You have 10 seconds to explain why.
Okay.
All right. So, question number 1. Whitening damages your teeth.
Fiction. Whitening done properly will not damage your teeth because it's controlled and it's done by a professional that have studied the chemical and everything, and he knows what to do.
Okay. All right. Sounds good. Now, if your gums bleed, it means you should stop brushing.
Fiction. Gum bleeding. If your gum bleed, that actually means that there's a problem. There's some plaque underneath the gum that needs to be removed. You just need to brush properly. First, go to your dentist to make sure that all of those residues underneath the gum are removed, but you should definitely continue to brush.
Got it. Chewing gum can replace brushing.
Fiction. Chewing gum has nothing to do with brushing. The gum will not go underneath the gum. The gum will not go underneath the actual gum to remove all of the plaque and free the gum from any infection. Fiction.
Alrighty. If your teeth don't hurt, they are healthy.
Fiction. You don't know what's underneath the tooth. In fact, the most damaging condition within the mouth don't hurt.
Okay.
So that's a fiction.
Wow. And you've actually encountered situations like that?
Many situations, with... but now it's not part of the game, right? I passed that question, right?
You passed.
So, yeah. So, a lot of time, the things that actually, when, for example, we just talked about periodontitis.
Yes.
Which is the damaging of the bone itself and then the gums and everything. When that happens, it does not hurt. In fact, most immigrant, most African don't suffer from a lot of caries, actually, from my experience. They suffer from a lot of gum disease. A lot of people, Americans, a lot of people that grew up in this country, for example, suffer more from caries than gum disease. Okay. Again, that's why I'm in this community, because I understand that it's not everybody that do, but I do because I took the time to study that difference. Why? Because Africans or immigrants, we genetically have stronger teeth. I'm not saying that people here don't have these. But the gums, because we never go to the dentist, imagine going to McDonald's, buying a piece of food and leaving it on this table there for, not McDonald's, just food. Leaving on that table for years. What you think going to happen? A mess. Yes. Bacteria gets on there. When it stays underneath the gum, because you don't see, stay there for years. Bacteria invites itself there, and it starts damaging the bone from the inside, but you don't know. It don't hurt at all. In fact, sometimes you might even feel better, but you don't know what's going on until a dentist take an x-ray and tells you, listen, it's bad. Wow. So that don't hurt, but it's dangerous.
All righty.
Yeah.
All right, thank you. Wisdom teeth must always be removed.
At the right age. Fact or fiction? Fiction. I would say fiction. Because at the right age, once you pass the 20, so like I said earlier, once you pass the 25, I would say 30, 35, I just leave them alone.
Okay.
Until now you're in pain. You come to me and then we deal with that. So it's not an always thing. It's a case by case.
Okay.
Yeah, it's a case by case. But between those age range, the late teens, early 20s, yes. If they are there, yes.
Okay. Alrighty. Charcoal toothpaste is safe for daily use.
Fiction. Because it's not an ADA recognized toothpaste. However, I answer the question.
Yes, yeah.
Now I'm going to give can I give a little explanation on that? Okay, so I'm this type of dentist that don't believe that we don't know everything. As a doctor, I just gave you the doctor answer, right? because it's not ADA approved, ADA, which is the American Dental Association, you know, they don't believe that the charcoal toothpaste have all of the chemical that they believe that from the research of the lab can actually do the job of cleaning teeth. Okay, fine. But me personally, I'm the type of doctor that's open-minded. I've seen some people. I came to this, to this clinic and told me about ways that they've been using to maybe stop pain. That is not ADA, that we don't know about, and it worked. I keep telling them, listen, if it worked, keep doing it, And I had the opportunity to travel to some countries, maybe Indonesia or whatever, and I see them doing things that the ADA don't approve and stuff like that, and it works. So if it works for you, fine. But the charcoal toothpaste, come on, it's not. It's a lot of things, within reasonable limits, right? Some people that say, "Oh, he just breaks." I heard one time somebody said that he just grind the skin of an egg and he brush with it. That's it. No. It's, you got to be reasonable. So that's why we have to abide by the ADA rules and everything. But, I cannot say yes. Yeah.
All righty. This one, I'm sure you already touch on it, but Africans naturally have stronger teeth.
I will agree. Generally, but there's some African with weak teeth. But in general, if I have to say, African generally have stronger teeth.
Okay. All righty. I want your honest answers, okay?
Okay.
On this
one, okay.
Next one, yeah.
It must be an answer. It must be an interesting one.
For you now. Coffee or tea? Which one do you prefer?
For me,
yes.
As a consumer,
yes.
Or as what I should recommend people.
As a consumer, what's your recommendation to people?
I consume neither. I don't drink coffee or tea. It's a personal choice. It's a preference. Not to say that don't do it. I mean, there's dentists that drink coffee or tea or tea. I don't consume either. But if I was to, let's say today I start, just for some reason I gotta start when I would say tea.
Okay.
Coffee. Not to say that it's bad, but again, those are the two options that I have. Right?
Yeah.
Coffee. A lot of the people that have a lot of stain that I see, oftentimes it's from coffee.
Okay.
And that stain could be misdiagnosed by a dentist that don't know as a cavity. Oh, because it's black. Oh, it's a cavity. No, it's not a cavity. And then now they end up drilling your tooth for no reason when it was just stain.
Oh.
So if I have to choose, I would say tea.
All righty. All right. Now, do you floss every day or only when something is stuck in your tooth?
Myself?
Yes,
or
you.
Do I floss every day?
Yes.
I have to be honest. No, I floss most days. I floss most days, about maybe 3 times a week.
Okay.
But every day, no.
Is it recommended to floss every day?
It's recommended, but if you but I understand. Life is what it is. Listen, if you brush twice a day, and you floss twice a week, I'm okay with it. There's some of my colleagues that might chew me on this, but listen, taking care of your teeth it's not that hard.
Okay.
Brushing twice a day, you give me 2 times a week of flossing, I'm okay with that.
Got it.
Yeah.
Got it. Do you use hard toothbrush or soft one?
A softer toothbrush. And that's another thing with African. They want, when they go on the market, they want the strong one. Let me get the one that... I mean, in fact, I was one day with one of my friends and the way, it's how you brush. It's not, it's how you brush. It's, the way, we got to do it. You're doing this only on the teeth, but you're not, the bristle, it's not penetrating the gum.
Yes.
You must brush in a circular motion.
Okay.
In a circular motion from tooth to tooth. Take your time. Take your time. Once you do that, I always say, once you do that, okay, go back to the normal way of brushing, but not hard. Okay. Just to pleasure yourself. Because if you use a circular motion, again, mindset again, as an African, you're gonna feel like you haven't brushed. Just because you haven't used that, you have not. So do both. So do that circular motion and do that motion, the back and forth motion, but softly. I'm okay with that.
All right.